I'm very, very happy to be here with one of my patients, Ben, and he's a great success story. I'll try to summarize it quickly, and it points to that there's a method to my madness in terms of what we try to do with our patients. When Ben first showed up to me, this is probably a couple of years ago, he was pretty much a Norwood 5, and he had not so great donor hair. It was okay, but I knew it could be improved.
It was about 19 or 20 when I started noticing my hair loss. It was about when I turned 25, I think, that it got really bad to where other people started to notice it. And I pretty much just wore hats for 10 years after that until I finally started researching how to possibly fix it. I watched a ton of different YouTube videos of different outfits that do hair restoration surgery. Even looked into the going overseas and having it done. And in the end, what I found was that Dr. McGrath was the highest rated one and seemed to be the best surgeon out there. So that's why I chose him.
This is what I talk about with the optimization. So he was very patient. He was very, dedicated to the path that we were going to take. We started him on the combination therapy.
He was more concerned about the outcome than just selling a surgery. So I went on the medication that they gave me. I think I was on it for 9 months before they were finally willing to do the surgery.
We planned the procedure for like trying to get upwards of 3,000 grafts. Well, it turned out that his density was so good and his flexibility was great. I was able to get a pretty decent size FUT strip. We ended up with, what was it, Ben, 4,160 something grafts?
Yes.
And that gave me the ability to cover 2/3 of his scalp and give him a very nice dense look. But it took a little work. It took a little time for us to get there. We can comb through this. And the beauty of this is he's got a very nice dense result. He's very pleased with where he is. It's very natural. You can see how it fits the face and blends in perfectly with the temples. We did a little touch up on the temples as well. And that's why, for example, I'm so proud of this and proud of Ben because he stuck with it. You can see, even with his hair relatively short right now, you can't really appreciate that there's any significant scarring, which is very important because a lot of people have the false impression that if you do an FUT, you're going to be left with this monster scar. That's a false narrative. When it's done properly, they get a very, very nice result. I know how to get patients from point A to point B. The question is, are they going to trust me and are they going to believe in me that I know what I'm doing? And he did. And this is the result.
I am extremely happy with the results, especially considering how bad my hair was before.
We're planning for a second surgery where we're just going to fill in the crown. Truth is, I can get this done with 2 or 2,500 grafts, and I could do FUE because we can hit that number easily. But the reason that that would be possible is because he has still retained his overall density.
Dr. McGrath tells me that there's even more growth coming for the first transplant, and after the second transplant, I think I'm going to be extremely happy.